In this lecture, we're going to show you how to actually teach the clinician to use the supernova for intraoperative nasal CPAP. Let's first start by going over what the objectives are for this clinical training 1. First, is to teach the clinician how to set the supernova up in the OR in order for them to use. Next, we need to get the clinician to believe in the clinical benefits of nasal CPAP. If they believe in the clinical benefits, then they will continue to use the supernova device. In order to get them to believe that the supernova is working, we're going to teach you what parameters the clinician should focus on in order to show them that the supernova is helping maintain effective ventilation intraoperatively. Finally, we need you to get the clinician to the point where they feel comfortable using the supernova for nasal CPAP by themselves. That way, once you're not there, they will continue to use the supernova for nasal CPAP. Let's first start by showing you how to set the supernova up in the OR for nasal CPAP. The first thing that we need to make sure is that the oxygen is turned on. In order to do that, we want to look at the anesthesia machine and make sure that there is flow going into the flow meter. Here in green is oxygen. This means that oxygen is actually flowing into the anesthesia machine to the patient. The reason why this is important is if we remember, pressure equals flow times resistance. In order for us to generate a positive pressure, which is what we want to do, we need oxygen to be flowing. Without oxygen, the supernova will not function properly. Next, we want to connect the supernova to the anesthesia port, as shown here in the picture. After that, we want to place the supernova on loosely so that it's comfortable for the patient while the patient's still awake. However, once the patient goes off to sleep, we then want to tighten the Velcro straps so that it creates a nice tight seal around the patient's nose. Once the supernova is tightly placed on the patient's nose, it's time to generate pressure. In order to do so, you want to recommend to the clinician to start by turning the pop-off valve to 10 centimeters of water pressure. This will allow pressure to be built up within the system. As you see here, this is the pop-off valve, and this is what you would recommend that the clinician turns, starting off at about 10 centimeters of water pressure. Next, we have to make sure that there is no leaks in the system. In order to do so, look at the anesthesia bag. Make sure that the anesthesia bag is completely inflated. This will ensure that there are no leaks. If the anesthesia bag does not inflate, the first place to check for a leak will be around the supernova. Now that the supernova is ready to be used for nasal CPAP, we need to get the clinician to believe in the clinical benefits behind nasal CPAP. We want to first start by reminding them what those clinical benefits are. It's important to explain to them that nasal CPAP has been shown to relieve upper airway obstruction in the OR, and that they will induce upper airway obstruction anytime they provide either sedation or general anesthesia. Next, it's also important to remind them that nasal CPAP has been shown to prevent and treat atelectasis, and that they will be inducing atelectasis every time they give either sedation or general anesthesia. Once they understand the clinical benefits of nasal CPAP, it's important for you to explain to them that you'll be teaching them key parameters for them to evaluate the effectiveness of the supernova in performing nasal CPAP. Next, you want to explain to the clinician that there will be 4 key parameters they should monitor to prove that the supernova is being effective in helping them maintain ventilation for their patient. The first parameter they want to start looking at is the anesthesia bag. Next, they want to monitor peak airway pressures on the anesthesia machine. Third, you want to have them monitor the pressure waveform curve on the anesthesia machine. And finally, they should be listening for snoring. The first key parameter that the anesthesiologist should be monitoring is the anesthesia bag. The anesthesia bag should completely inflate and then slightly deflate, as shown here in the pictures. When the bag completely inflates, this is signifying that the patient can actually exhale and is blowing into the bag. When the bag slightly deflates, that means that air was drawn from the bag, that the patient was sucking oxygen from the bag, which means the patient must have generated a breath by inhaling. This is the first parameter that helps prove the patient is effectively being ventilated. So in summary, the anesthesia bag should completely inflate. This helps us tell that the patient is exhaling, and it should slightly deflate, which means that the patient inhaled. The next parameter that we want the clinician to monitor is the pressure waveform curve, which is seen on the anesthesia machine, shown here. The pressure waveform curve lets us measure the pressure during expiration and inspiration. It also lets us know that the patient is maintaining effective and spontaneous ventilation. Let me show you how. On expiration, you'll notice that the bag will inflate. This is because the patient is exhaling into the bag. It correlates with the plateau on the pressure waveform curve. The dip, as seen here, this is signifying that there is a loss of pressure within the system. That is because the patient is taking a negative breath, and you will also see that the anesthesia bag at this time will slightly deflate. As soon as the patient exhales again, you will notice that the pressure goes back up. This also shows us that a continuous positive airway pressure is being maintained since the dip never goes to zero. The final key parameter you want to have the anesthesiologist measure and monitor is snoring. You want to have the clinician listen for snoring just as the patient starts to fall asleep. This is a sign that the airway is partially obstructed. Next, once the pop-off valve is between 10 and 20 centimeters of water pressure and nasal CPAP is being applied, the snoring should get softer. What this implies is that the airway is opening up, becoming more patent, and allowing for more flow. If the snoring is a little bit softer, but not completely gone, you then want to advise the clinician to increase the amount of pressure being delivered by adjusting the pop-off valve, maybe from 10 centimeters to either 15 or 20 centimeters of water pressure. Obviously, the more pressure that is being generated into the patient's nasal pharynx, the more the walls of the nasal pharynx will be separated and the more patent the airway. Finally, we have to get to the point where the clinician feels comfortable performing nasal CPAP on their own. In order to do so, we want to make that transition process as painless as possible. So, it'll be important for you to have the clinician demonstrate that they can set the supernova up properly and perform nasal CPAP while they're with you. During this time, continue to reiterate the positive effects, such as the ease of use, how the patient feels comfortable, and maybe ask the patient whether or not they feel more comfortable with a nasal mask or a full face mask. And continue to point to the parameters that are helping to prove that the supernova is maintaining effective ventilation. Finally, remind the clinician to always listen for the sounds of snoring. If it reduces, it means that the airway is becoming less obstructed. You want to repeat this process until the clinician is ready to use it on their own and truly feels comfortable. Let's summarize how to set the supernova up for nasal ventilation and how to monitor to make sure that the patient is effectively being ventilated. First, turn the oxygen on. Second, place the supernova loosely over the patient's face while the patient is still awake. Once the patient goes off to sleep, tighten the Velcro straps to create a seal around the patient's nose. Have the clinician set the pop-off valve between 20 and 30 centimeters of water pressure. Next, have the clinician perform the thumb technique in order to mask ventilate the patient. Then, make sure the anesthesia bag completely inflates, and every time the physician squeezes the bag, they should see the following: chest rise, mask condensation, and the anesthesia bag quickly reinflating. The first step in setting up the supernova is turning on oxygen. In order to do so, we want to make sure that the flow meter registers at least 5 liters per minute. So when you walk into the operating room, make sure that the flow meter is on so that oxygen is being delivered to the patient. Next, for nasal CPAP, you want to tell the clinician to turn the pop-off valve, as shown here, between 10 and 20 centimeters of water pressure. This will allow pressure to build up within the supernova chamber. From here, you want to make sure there are no leaks in the system. Tell the clinician to look at the anesthesia bag. The anesthesia bag should be inflated, as shown here. If it deflates, like this, that means there's a leak in the system, and you would want to check the seal around the supernova. Next, you want to demonstrate to the clinician that the supernova is providing effective, continuous positive airway pressure, or effective nasal CPAP. In order to do so, first have them look at the anesthesia bag. Notice how it's inflated. When it slightly deflates and then reinflates, like so, this means that the patient is generating a negative pressure anytime the bag deflates, i.e. they are sucking oxygen from the bag. When it reinflates, that is the patient exhaling back into the bag. This shows the clinician that the patient is spontaneously breathing on their own. The next parameter you want to look for is peak airway pressure, shown here 15. This should correlate with the pop-off valve, which shows 15 as well. If the two correlate, that means there are no leaks in the system and a continuous pressure is being built up. If this was less than 15, that would mean that not all the pressure is being generated to the anesthesia machine and that there is a leak in the system. The third parameter you want to look at is known as the pressure waveform curve, as shown here. Anytime the pressure waveform curve dips, like so, that means a negative pressure was generated. The only place a negative pressure can come from is the patient inhaling and sucking gas from the bag. When the pressure goes back up, that shows that the patient is exhaling. This is another way to prove to the clinician that the patient is maintaining effective ventilation and that a continuous positive airway pressure is being applied.